Good morning, everyone. Welcome to our webinar on music therapy and FND. My name is Lulu, and I am an occupational therapy student from the University of Sydney. I registered music therapy with Australian Music Therapy Association and a neurological music therapist trained by the Academy of Neurological and Music Therapy. This is my sixth week of occupational therapy placement with Kate at FND Australian Support Service, meeting with the members and gaining more knowledge about FND and how people manage their symptoms has been a great learning experience. During my time here, I met Cecilia, our guest speaker. She shared her unique experience with music therapy. Her story inspired me to deliver this webinar and share my knowledge and understanding of music therapy and FND. So today we will explore what music therapy is, how receptive and active music therapy approaches and neurological music therapy approaches will help people manage their FND symptoms and improve their quality of life. Following this, we will have a 15-minute interview with our guest speaker, Cecilia, who will share her unique music experiences and the wonderful music she created with her music therapist, Karina. The interview has been pre-recorded and includes Cecilia's music and more visual information for better understanding. After the interview, we will have a brief conclusion and a Q&A session. During this webinar, we will share some music and videos. If you find the sound disturbing, please feel free to take a break anytime. So firstly, we will find out what music therapy is. Music therapy is a research-based allied health profession in which music is used to actively support people as they aim to improve their health, functioning, and well-being. It can help people of all ages to manage their physical and mental health and enhance their quality of life. Regardless of our musical abilities, in music therapy sessions, qualified music therapists plan and provide musical experiences that are personalized to each client's specific needs and goals. In 1998, Professor Kenneth Brissia identified four main music therapy methods: receptive, recreative, creative, and improvisation. These are based on improvisational, compositional, and music listening opportunities that music therapists engage with clients. Depending on the client's strength, goals, and needs, the therapist adapts both receptive and active music activities in the session. In active music therapy, the client is involved in actively creating or playing music, which is more interactive and hands-on. For example, improvising on the piano with the therapist to improve the hand functions. You can also achieve this through exercise for hand strength. This video has no sound. This video got sound. You can hear people playing on the percussion instrument. Can everybody hear the sound okay? No? Okay, just give me 1 second.
The sound didn't come through, Lulu.
Sorry, give me 1 second.
Yeah,
So, playing percussion instrument can enhance hand-eye coordination and develop fine motor skills. For instance, hitting on the soundboard with a mallet and holding it requires a similar motion as holding a knife to cutting vegetables. Similarly, playing a hand drum with both hands can help improve bilateral coordination. Gonna play another video for you. Playing body percussion with playing body percussion with repetitive rhythmic patterns and the movement stimulates awareness of the body, control of movement, and muscular strength. It also improves coordination, balance, and motions, concentration, memory, and perception. Now we move on to receptive music therapy. Receptive music therapy involves listening to music for relaxation, to change the mood, to help manage anxiety and depression symptoms, or to facilitate an individual's attention and arousal. For example, people use functional music to improve their attention while studying, or musicians listen to music to reduce their anxiety before a performance. The school use music for transitioning between activities. Many people listen to music they enjoy, helping improve their mood. As a music therapist, using receptive music is not just about lifting the client's mood, it's about building a therapeutic relationship with the client, providing an outlet for them to express their feelings or thoughts. Studies indicate that music therapists use live music that can be modified or adapted in the moment according to the client's response. For example, when a music therapist plays live music for a person in a state of coma, the music is not only about individuals' preferences, but also it matches the individual's breathing patterns or heartbeat. Music therapists use music parameters such as tempo and rhythm, which can be adjusted to increase a person's attention or arousal during the therapy. Personalized music content, including the person's name or familiar voices, can also be incorporated to enhance effectiveness of the treatment. One of the interactive relational approaches of receptive music therapy is called guided imagery music. GIM is a psychodynamic and multimodal therapy that incorporates music listening in a deeply relaxed state to stimulate imagery, memories, and feelings to help the client understand life issues from a holistic perspective and to promote mental and spiritual well-being and health. It requires additional training for a registered music therapy to become a GIM therapist.
Individual GIM sessions begin with a relaxation induction, and when the client is fully relaxed, the therapist selects pre-recorded music that matches the client's need. While the music plays, the client describes what he or she is experiencing, and the therapist transcribes key images. Once the music finishes, the client is encouraged to draw some of the images or feelings from the session. They may choose a mandala or use other art materials such as clay modelling or sand tray. GIM is most successful when a series of sessions is undertaken to address a particular issue. This gives time for trust to develop and for the client to lead the way in their process.
People with FND may also experience other mental health conditions such as anxiety, panic attacks, and depression. So, in music therapy sessions, the therapist can use music and image that integrate art and music activities to facilitate self-expression and relaxation. Art and music offer different modes of expression, integrating both to facilitate self-expression through multiple media. Later on, Cecilia will share a little story about her experience of music and art activities in her music therapy sessions. As we know, FND is a neurological disorder that can cause limb weakness, paralysis, seizures, and fatigue. It impacts people's movement, speech, emotion, and psychological well-being, and sensory and cognitive functions. The studies and research about music therapy and FND are very limited. I only found a couple of case studies that showed the effectiveness of music therapy for FND. However, neurological music therapy has been found to be effective in improving speech, psychological, behavioral, cognitive, and motor functions for people with many other neurological disorders, such as dementia, stroke, Parkinson's disease, and autism spectrum disorder, traumatic brain injury, and so on. Neurological music therapy is an evidence-based treatment that uses standardized, research-based techniques to treat the brain by utilizing specific elements of music such as rhythm, melody, dynamics, and tempo. The neurological music therapists use standardized techniques to address non-musical goals. These goals may include improving speech, physical movement, cognition, and other functional abilities. During therapy sessions, the therapists focus on music as therapy, emphasizing specific elements of music in the interventions. To optimize function or reroute neural pathways to achieve functionality. The main difference between music therapy and neurological music therapy is that music therapy sessions, sometimes music is therapy, which can improve mood, increase expressiveness, and facilitate interaction with others. However, in neurological music therapy sessions, all the interventions are structured with standardized techniques, and the NMT focus on using music more as a therapeutic tool to achieve non-musical goals. I want to show you some videos about the standardized techniques in NMT. Please feel free to take a break if you find the music is disturbing or too overwhelming. Firstly, we would like to talk about rhythmic auditory stimulation. This technique uses auditory rhythm to improve the control of movement for people with significant gait deficit due to neurological impairment. So in this video, Mark has a spinal cord injury after a car accident. In order to improve Mark's walking, the therapist used repetitive rhythmic patterns to increase his stride rate, weight-bearing capacity, and range of motion.
That was awesome. Yeah, do it again. Yeah, there you go. Good, one more. Awesome.
Oh, wait a minute. Whoa.
Yeah, get your balance.
Yeah.
I think it is a great video to show you how music helps the client to regain his walking capacity. The therapist in the video helped Mark improve his walking through graded activities that involve predictable and repetitive rhythmic patterns to improve his movement and coordination. Also, this is more fun and motivating for both staff and the client. With a therapist, the speed of the music can also be adjusted according to the client's needs. So many people with FND may also experience brain fog, reduced attention spans, and difficulties holding a meaningful conversation with others. Um, musical attention control training involves structured active or receptive musical exercises using pre-composed performance or improvisation in which musical element cue different musical response to practice attention functions. The second video is from my client Jason and me. I'm on the piano and Jason is playing the tongue drum. Jason had a traumatic brain injury after a car accident, which caused reduced hand strength and upper limb functions. He has tremors and has difficulties sustaining his attention or maintaining a conversation with others. The activity aimed to improve his attention and nonverbal communication through improvisational activity. So the whole video lasts about 5 minutes. Jason was able to improvise with me at the same tempo, and he was also able to sustain his attention throughout without any verbal prompts. He was able to maintain a meaningful musical dialogue and play beautifully. The next video is about NMT techniques to facilitate speech and language. People with FND may also experience slurred speech and have difficulties pronouncing certain words, mumbling, or changing the speed and rhythm when talking. So therapeutic singing and melodic intonation techniques to improve speech and language. Therapeutic singing aims to improve speech and language skills and breathing function. It involves using unspecific singing activity to initiate, develop, and articulate speech and helps with neurological or developmental speech and language dysfunctions. Melodic intonation therapy helps individuals with expressive aphasia, which is a condition where a person may understand speech but have difficulties speaking fluently themselves. So MIT helps them regain their ability to speak naturally with using sung or chanted melodies that resemble speech intonation patterns.
Try it again.
Messes up. I'm Peter. I'm Peter. I'm Peter. How are you? How are you?
The last video is about therapeutic instrumental music performance, which is an exercise to stimulate functional movement patterns through instrument playing. Appropriate music instruments are selected to improve the range of motion, endurance, strength, functional hand movement, finger dexterity, and limb coordination. I'm going to show you the video from me and Sihan. Sihan is 12 years old and she has profound intellectual disability, autism spectrum disorder, and global developmental delay.
一闪一闪亮晶晶，你来，满天都是小星星，你来，挂在天空放光的，好像许多小眼睛。一闪一闪亮晶晶，满天都是小星星。
So Mandarin is a primary language at home. We sang Twinkle Twinkle Little Star in Chinese version. In this session, Sihan is aiming to improve the range of motion of her up limbs. For example, overhead reaching, forward reaching, grasping, and sliding the wind chime, as well as strumming the guitar to improve her finger strength. So these are some examples and activities in a music therapy session that a client may participate. Depending on individuals' background, values, strengths, needs, and goals, the experience with music is quite unique and diverse. Now is the time to welcome our guest speaker Cecilia to share her unique experience with music therapy. I'm gonna stop share here and then turn on the video. Everyone, 1 second. Okay, here we go.
Come on, come on, come on, come on.
Yeah, koala, koala. You comfort me, you comfort me. When we're cuddling, you keep me company, company, company.
Love it. Good afternoon, Cecilia. Thank you for participating in the interview today. How are you feeling?
Tired.
You're feeling tired. Yeah. Oh, thank you very much for joining us. I really appreciate it. During the interview, if you need a break, like anytime, let me know. So, Cecilia, in today's interview, we will go through some questions about your unique music experience. How did you become interested in music therapy, or how were you first introduced to music therapy as a treatment for FND?
It was when I was in the rehab hospital in 2021. I was doing physio, and my physio was using music as like a distraction when I was trying to walk, and she said that the hospital had a music therapist and referred me to the program. So I started with a music therapist and a music therapy student, and they introduced me to the keyboard, and they helped me learn how to play the keyboard again and help set up Spotify playlists for me with my favorite songs, because I'd completely forgotten what my favorite songs were. But listening to the music in the gym on the radio helped me remember music, because I completely lost my memory. And Yeah, then I started playing the keyboard and getting memory back of how to play. And when I first started playing the keyboard, I couldn't even play a note on the keyboard. I had no hand strength or coordination to do it. So, with practice, with having a keyboard in my room, I gained some strength and could start to play again.
That sounds great, Cecilia. You mentioned in the hospital they help you to play on the keyboard. Have they used any strategies like maybe letters or like color dots to help you to mark the notes?
I couldn't remember how to play the music, so I couldn't read music anymore. And so they had to write letters on the music because I couldn't remember the bass clef and the treble clef. I still can't remember bass clef, but treble clef I can read a bit more now. And so writing the letters on the music really helped me to remember how to play.
It sounds great that the music therapy in the hospital helps you to use different ways to read music, which motivates you to continue practicing on the keyboard. And also, I'm really glad to hear that helps you with your hand function, your memory, and concentration. So after being discharged from the hospital, how did you have access to a community music therapist?
Well, the music therapist in the hospital wrote a letter to the NDIS because I needed to get a new plan when I was leaving the hospital because I needed a lot more support than I used to have. I needed carers 24 hours a day and I needed a lot more allied health. So she wrote a letter to the NDIS and they gave me 5 hours of music therapy for the year in association with speech therapy. And then they suggested that I look at the Registered Music Therapy Association website. And so I did that. And then I found myself a neurological music therapist and started doing music therapy with her.
When you start music therapy with a neurological music therapist, does that help you with your speech?
Yeah, my speech was severely affected by my seizures. And so I had very stuttered speech, very slurred speech. Sometimes when I have a seizure, I completely lose my speech. And I couldn't pronounce words correctly and I had foreign accents and things. So my music therapist did a whole lot of speech exercises with me and breathing exercises and trying to sing different sounds so that I could try and pronounce words correctly.
Yeah. Do you have any other goals or expectations when you first start your music therapy sessions with a community music therapist?
Well, when I was in rehab, we discovered that singing helped my speech return when I'd lost my speech. So I wanted to continue singing with my music therapist to get my speech back. And for a while, that really helped when I was having my seizures. Yeah. Unfortunately, it doesn't help anymore. But I didn't really have any particular goals because I still wasn't really sure what music therapy could offer me. But then she introduced me to a lot of different things like singing and playing the guitar, and well, she plays the guitar and I sing, and playing the piano and teaching me new songs on the piano that I like, and doing music and imagery and lyric substitution.
Yeah, that's great. Like when you play on the instrument, do you find that will be like maybe helpful with your head function?
Yeah.
Do you feel you can, through a playful way, just to improve your head function a little bit?
Yeah, it does help because when I first started playing the keyboard, I had no strength to play anything, but I was also having to do intense OT work to try and get my hands working again because I completely couldn't use my hands when I was in rehab 2 years ago. But with really intense work, I've got better at using my hands and now I can play the piano again.
That sounds great. Thank you, Cecilia. And I think it is great to have goals in the therapy sessions. So it helps both the therapist and the clients understand what they aim for, what they're trying to achieve during the session, and also keep people more motivated. A therapist, as you said, will provide more individualized activity that suits your interests and your needs. You've mentioned like some interventions that we'll be trying in the therapy sessions, like you create a playlist suitable like for different moods or situations, and also use music, the guided music and the imagery activity to help you to express yourself. Would you like to share a little bit more?
Well, the guided imagery was my music therapist playing music on the piano or the guitar, I think, or maybe it was a CD or something on an iPad. I can't really remember. And then I had to close my eyes and imagine what I could think of when she was playing the music. And I remember she played a piece called, I don't know how to say it, probably Beginopedi or something. And when I closed my eyes, could see like little flower girls dancing around in a field and little frogs and toadstools and things. That's what I imagined. So that's what I drew. But I'm not good at drawing. I'm better at playing music than I am at drawing. So that wasn't very good. My frogs did not look like frogs.
That sounds really interesting. How do you feel after you complete like a session? For example, a complete guided imagery activity with your therapist. Do you feel relaxed or do you feel a bit tired? Or how do you feel?
It depends. Like if I have a seizure, I feel tired. Like sometimes I'll have seizures during sessions and that makes me feel tired and deflated. But if she does like sort of mindfulness relaxation activities with me, that makes me feel more relaxed. And playing the piano and singing, and when we create songs together, I enjoy that. Like the seizure song that I created, that was really good because it sort of was something really distressing for me, but I was able to see it in a new sort of lighter way. And that helped me deal with and like process with what happened and the fact that I have seizures everywhere all the time.
Yeah. So, Cecilia, would you like to share that song with us today? Can I play it?
Yes, please. Well, I was cuddling my koala on the couch when I fell off it, when along came a seizure and it stopped me in my tracks again. If you're going to take me to hospital, maybe me can ride. So I got into the ambulance and I settled down inside. They took me to the hospital, but it was bloody useless. I said, listen, mate, I've had seizures everywhere on this land. I've had them everywhere, man. I've even flashed a fireman in the shower, bare man. I've been paralysed in there, man. Seizures, I've had my share, man. I've had them everywhere. Pier, beach, wheelchair, kitchen, table, lounge room, bathroom, office, park, swing, couch, kitchen, bedroom, shower, toilet, commode, car, shops, doctors, ambulance, hospital, backyard, front yard, lounge room, piano. I've had them everywhere, man. I've even flashed a fireman in the shower, bare man. I've been paralysed in there, man. Seizures, I've had my share, man. I've had them everywhere. I've had them here, there, everywhere. I've had them everywhere.
Alright, so Cecilia, you mentioned like you using like a lyrics substitution a lot in the music therapy session. Is the seizure song like you created with that method as well?
Yeah, so I did the song I've Been Everywhere, Man, and I changed it to I've Had Seizures Everywhere. And I've done another song, Karma Chameleon, because my favourite soft toy, a weighted toy koala, is called Karma the Koala.
Yeah.
And it's not the same karma, it's Calmer, and it comforts me, so I changed the lyrics to that song to be about my toy koala Karma. I changed the lyrics to the song I Get Knocked Down But I Get Up Again, because when I was in rehab, I spent weeks, just like over a month, being bedridden when I first started having seizures. They were calling them unconscious episodes. They didn't know what was going on and we were really scared, so I wasn't allowed out of bed for weeks and not allowed to do any therapy, not allowed to even go to the bathroom, the toilet or shower or anything. It was horrible. And then when I finally got up and I was allowed to take a step, I just got that song in my head, I get knocked down but I get up again, because the FND knocked me down, but I was getting back up again and I was trying to walk, and I tried doing physio and I took a step forwards and a step backwards, and I can do walking too. Take a step forwards, take a step backwards, take a step forwards, and take a step backwards. And soon I'll be walking with the walking frame, and soon I'll be walking on my own again. Oh, Lauren, girl, encourage me. No, I'll try. I get knocked down, but I get up again. You're never gonna keep me down. I get knocked down.
up again. You're never gonna keep me down. I get knocked down, but I get up again. You're never gonna.
All your music sounds really energetic and uplifting. I guess music would help us to explore our emotions and provide a safe space for us to express our feelings and thoughts. And also, it builds a connection with others as well. So, Cecilia, since starting music therapies, have you noticed any changes in your symptoms, mood, or overall well-being? And in what ways has music therapy been helpful in your journey with FND?
Well, at the start, it really helped my hand coordination, and it helped my memory by getting my memory of music and songs back and how to play the piano. And then discovering that singing could help me get my speech back when I lost my speech with seizures. And then doing like sound, like work with creating sounds to different notes on the piano and things helped me pronounce letters and things better. And then I feel relaxed doing relaxation exercises, and then like when I created the seizure song, being able to share that with other people really helped me to express how I was feeling about my seizures. And yeah, it's just music's been really beneficial in so many ways, and I think mainly because music is something that I'm passionate about and I'm interested in, and I'm not particularly good at it, but it's not something that I struggle with as much as other things. So for me, it's a therapy that I enjoy compared to, I mean, I enjoy my other therapies, but they're focusing on my deficits and the things that I can't do, whereas music therapy is focusing on the things that I can do and my strengths.
Oh, well, thank you, Cecilia. I think that's our interview.
Thank you.
Yeah. Thank you, everyone. And we go back to our slide and just a quick conclusion of today's webinar. Second. Sorry, so 1 second. So music is a compound language of time that has a unique ability to access the affective and motivational symptoms in the brain. Participating in music activities release dopamine, which can help us to feel happier. Music as therapy enhance our perception processes, particularly in coordination, language, and motor learning. Music allows for emotional expression and improvement of the motivation for rehabilitation activities. To conclude our session today, whether music is therapy or music as therapy, they can be merged in the therapeutic context. Sometimes music is therapy. There is no limitation for individuals to enjoy the benefit of music in their personal life, regardless of the music quality, health, and functional capacity. Music therapy is not just for professional musicians. Anyone with music skills can use it to help others. What sets music therapy apart is the training of clinicians and the use of theoretical principles based on the evidence to guide their technique and responses. The research and studies of music therapy and FND are very limited. However, it has been proved that music therapy is beneficial and effective for other neurological conditions, in particular to improve movement, facilitate speech, and manage complicated feelings and emotions, increase attention spans. And also, from my own perspective, I think most importantly, music helps a person to have a choice and control. As Cecilia mentioned, music therapy focuses more on your strengths other than deficits. So thank you everyone for your time. Please let me know if you have any questions. Yeah, it's our Q&A time. Any questions?
Thanks, Lulu. Do you want to go back to the screen where we can see everyone, so I can see people jumping in?
Yeah.
Awesome, cool. Thank you. That was really good. And thank you, Cecilia, for sharing your story and your music. It was lovely to see and really inspiring and useful for people to see how others with FND can benefit from music therapy. And certainly, you know, I've seen people, when you tap into learned movements, which you can with music, whether or not it's through dance or through playing piano, etc. I have seen a lot of people who have a background in, say, playing the piano really benefit by tapping into learned movements with music therapy for FND. So I think it's quite a powerful tool that has really been underutilized in FND therapy. Yeah, I love the Everywhere song too. It was fantastic. Yeah, it was really good. Does anyone have any questions for Lulu? So we've been really lucky to have Lulu, who is a neurological music therapist prior to doing her OT training. So really grateful. So I can't read your name, sorry, but is it Kimberly? No, I can't read it, but someone's got their hand up. You want to just unmute yourself to talk to Lulu?
Hi everyone. Thank you, Cecilia, for sharing that. It's helped me with I will try that for my speech. But I also want to ask, we talk about the emotional side it can help with. Because I'm just wondering, would it help to because my emotions have seemed to have gone standstill, if that the word, like I feel like I'm not feeling like I would normally feel at certain, for certain events that happen and stuff, like I can't cry, I can't. So would music therapy also benefit me with that, do you think?
I think it is quite unique for each individual, but
Mm.
in some cases, like if you have difficulty expressing your emotions,
Mm.
therapy will help you to improve your emotional awareness. So,
Yeah.
like, this is how I feel in certain situation, and then once you be able to identify your emotion, you will be
Mm.
able to find ways to express them. So
Yeah.
in music therapy session, we tend like using music activities to encourage the clients to express themselves through music. So
Yeah.
we can hear the difference, like when you play, if you initiate a happy feeling or if you initiate a little bit, distressed feeling,
Yeah.
and then we can sense that, and then we will match your emotion, and then
Mhm.
we'll help you to gradually will if it's a depressive like feeling,
Yeah.
will help you to gradually move out of that feelings.
Yeah.
And then with a the rapport, a relationship between a therapist and the client will
Yeah.
probably help you to identify some other coping strategies you can use at home or outside of the sessions.
Yeah.
So it start from the sessions, start within music, and then gradually help to improve and then to expand your ability to apply those skills in different environment and contexts. Yeah.
Okay.
Does that
So
answer your question?
yes, thank you so much. Thank you.
Thank you.
Yeah, I think music therapy will be like a powerful sort of communication aid. And in FND, we do see people become disconnected from emotions and sort of become numb and not sort of feel the emotions. It is something that is common with FND.
Okay. Yeah.
So I think tapping into creative arts through music therapy, art therapy, or any other form that you enjoy would be really
Yeah. Oh, thank you. And the music therapy, how do you tap into it? Is it through allied health stuff or?
There is an association called Music Therapy Association.
So we're going to do a flyer. So what we might do is we'll send an email out after the webinar and we'll do a flyer. So Lulu, if we can put that link in to the Music Therapy Association,
Yeah.
So that people can find, and also, you know, looking for what they look for, like a neurological music therapist.
Yeah.
So we'll send out some information at some point after the webinar with links to that. So if people want to follow up, they can.
Yeah.
Thank you so much, everyone. Thank you.
Thank you. And after this meeting, I would like to hear your feedback. And I'll create like add a little slide to create a word cloud. So if everyone can share a couple words about how you feel about the session and what the 3 biggest takeaway from the webinar, and that will be great. We'll include that in our summary flyer as well. Yeah.
Thanks, Lulu. Does anyone else have any other questions? And if something comes up later, you can email Lulu or myself directly. Lulu, so I've got the students around with me for another couple of weeks. Next Wednesday, we have Louisa doing another talk at the same time. So she's going to be doing a talk on the therapeutic use of gardening. And then the following Friday next week, Easterbrook will be doing a talk on sensory processing disorders and FND. So there are other therapies that can be really useful for people with FND. And I really think tapping into creative pursuits and things that you enjoy is really important in terms of FND wellbeing. Yeah, I like gardening as well. Yeah, I miss it in hospital. Any other questions that people would like to raise, or is there anything, if anyone wants to put in the chat to ask questions? Lulu, you can see the chat, can you?
Yeah, I can see the chat.
Yeah. So make any comments in there if you would like. I'd love to attend the upcoming sessions, please. So we have shared it in the group. I'll send out an email to our Kokorokoro cohort with the gardening registration link and then also the sensory processing one. Yeah. Cool.
And thank you so much, Cecilia, for being our guest speaker. And I think everyone enjoyed your interview very much and the song so uplifting. Thank you so much.
Yeah, excellent. Thank you. Yeah, it was great, Cecilia. And I love your song.
Thank you.
I even flashed a fireman.
I did. I had 4 firemen and 7 paramedics trying to get me out of the shower that day. It was very traumatic, but the music song helped me deal with it.
It does. It does. It helps you process it and put a different spin on the, you know, the really traumatic situation. Yeah, it's powerful. Yeah. Okay, bye, guys.
Bye, Kate. All right. Thank you everyone for joining us today. I hope you find the webinar helpful and then informative as well. I will share a link in our chat and also send you an email. It's about your feedback. Yeah, for our session. If you can provide some feedback, that would be great. I'll just get the link ready. Thank you, Karina. Karina is Cecilia's music therapist. She joined us today as well. She made a comment like, love how you demonstrate how music therapy helps both psychological and physical well-being for people with FND. Thank you, Karina. Would you like to make any other comment and share a little bit more with our members today? Can you unmute yourself? Oh, the microphone is not working. No worries. Thank you for joining us. Yeah. All right, ladies. If we don't have any other questions, I will share a summary with you, a flyer, including all the information about how you can access find a music therapist through our website, like Australian Music Therapy Association, and the Neurological Music Therapy Association. And if you have any other questions after the webinar, please just feel free to send me an email, and I'll try my best to answer your questions. Yeah. Thank you everyone for today. Hope you enjoy the rest of your day. Thank you, Cecilia. Bye.
Thank you.
Bye, everyone.